Guys, this is day 2 of our Mission Neet PG program. So, first topic is tyrosinemia. You have tyrosinemia 3 types. Type 1 it is fumarate acetate hydrolase, then tyrosine transaminase is type 2. So, you have to know which are the organs involved. So, type 1 it is associated with hepatorenal, type 2 is oculocutaneous. Now the toxic metabolite in phenylketonuria it is phenylacetone, and then you have alkaptonuria. Alkaptonuria it is benzoquinone. In tyrosinemia succinyl acetone. Mesial temporal lobe epilepsy syndrome, there will be hippocampal sclerosis in MRI. Spontaneous bacterial peritonitis, important point 1 is neutrophil more than 250 to diagnose. It is exacerbated by giving proton pump inhibitor. McEwen's triangle, what is the superior boundary? That is supramastoid crust or inferior temporal line. And one is along the external auditory canal. And one is a tangent drawn to that. McEwen's sign is in alcohol. Management of ulcerative colitis, remember mild, moderate, severe. So if it is mild, oral steroid and 5 ASA. If it is moderate, steroids give IV. If it is severe, steroids IV, not ASA, you have to give TNF alpha inhibitors. Conley's pointer is Straggle pointer. Diabetes in pregnancy, there is no role for anti-diabetic action is not there by HCG. Other hormones are involved in anti-insulin action. Anorexia nervosa, normal level of TSH. Gene in amyotrophic lateral sclerosis SOD. So the alopecia areata, you have to give intralesional steroid. Heart rate if less than 100, then you have to give positive pressure ventilation. If less than 60, chest compression. If more than 100 and labored breathing, you can give oxygen by nasal prongs if it is a term baby. If it is preterm, give what? CPAP. LGS, Lennox-Gastaut syndrome. First line drug is sodium valproate in whatever be the age. Tom Smith arthritis is septic arthritis. So telescopy test will be positive. The limb will be shortened. There will be more movement in that limb, that joint, hip joint. To differentiate it from development dysplasia of hip, the acetabulum is normal here, whereas in DDH, acetabulum is shallow. Derived from Meckel's cartilage is malleus. Liquid gold is amphetamine, that means urine also have it is most of that is excreted through urine. Nystagmus in phencyclidine intoxication. Skin receptor maximum in non-hairy skin is Meissner's corpuscle, and others are in hairy skin. And you have to remember which are slowly adapting. One is Merkel's disc, one is Ruffini. Village health nutrition diet is occurring once in a month by Anganwadi. In Anganwadi workers will be there, Asha will be there. The report they will send to MO. It is they are saying about health, nutrition health, family health, all the health. Global hunger index, you have to remember IMU. So undernutrition, mortality and inadequate food supply. So undernutrition, you have to remember the two things: stunting, wasting. Mortality is under 5 mortality, and inappropriate nutrition, that is undernourishment. Lines of Zan occurs in antemortem clot. There will be layer, and that one layer is platelet. The dark red is red cells, pale is platelet. What is the lifespan of platelet is just 1 week, right? So this lines of Zan occurs in flowing blood, that is antemortem. BG Prasad scale is applicable for rural and urban, and it is per capita income. Autoimmune hemolysis, autoimmune Hemolysis, you have to remember it can be cold and warm. So cold at 4 degrees Celsius, warm at 37 degrees Celsius. And IgG, IgM, IgG in warm. So it is CLL, SLE example, IgM cold, that is Mycoplasma and Epstein-Barr virus infectious mononucleosis. RVLM, CVLM, so in baroreceptor reflex, RVLM rise, so it is activation, increasing BP. CVLM, C for calm, decreasing. So when baroreceptor is getting activated, it has to work in such a way to decrease BP, right? So it will activate CVLM, it will inhibit RVLM. Schaeffer grading, remember 4 grades. Like Malambati also 4 grades, but Malambati you have to know normal is 1, but Schaeffer normal is 4. And Schaeffer it is mnemonic is STSC. STSCS for Schwab's line, trabecular measure, scleral spur and ciliary muscle. Suicide inhibition, example A for aspirin and allopurinol. Then O for omeprazole, organophosphate. Then next inspissation, LJ medium and low flow serum slope. Monoclonal antibody against integrin in multiple sclerosis is natalizumab. Hanging drop test you are doing in laparoscopic, whether it has pre-peritoneum or whether it has entered the peritoneum. So since if it is inside the peritoneum, when you drop saline, it will be sucked inside. Otherwise, if it is outside the peritoneum, it has not breached the peritoneal layer, then the saline will be at the tip of the needle in lap surgery. Then next is translocation 12-16 basophilic myxoid matrix is associated with liposarcoma. MRSA there will be MECA gene, VRSA MECA gene. MRSA MECA gene will alter penicillin binding protein. Double PCR in MRI, that will be actually it is the tearing of medial meniscus. Impedance audiometry is actually a combination of two. One is tympanometry and acoustic reflex. It is objective. Tropical pulmonary eosinophilia, the microfilaria was trapped in lungs somehow, so that there will be a hypersensitive reaction and developing this coughing, wheezing, the hypersensitivity symptoms. And the treatment is actually same only, diethyl carbamazine. Orbital fat decrease is the adverse effect of prostaglandin analog. Burns, the fluid management can be 4, 3 and 2. In pediatric, it is 2 in adult. In pediatric, give more fluid, so 3 times, that is 3 into kilogram into percentage body surface area. 4 is for electric burn or full thickness burn. Foramen related to parotid gland, right from the beginning, it's jugular foramen and then foramen ovale. Chaldosynthesis is done from Douglas recto-uterine pouch, and you are aspirating that blood. In ectopic pregnancy, it will not clot. Type 4 RTA, hyperkalemia, and remember it is because of hypoaldosteronism. What about renin? Also low. In Conn syndrome, what is the condition? There is hyperaldosterone and again renin is low. Aminoglycoside and acyclovir, aka difference is one is oliguric. Acyclovir is forming crystals and in obstruction in the tubule, so urine will not go. Oliguric, aka aminoglycoside, is non-oliguric, and even if the drug is eliminated, the effect persists. Lithium-induced nephrogenic diabetes insipidus. Usually you give thiazide, but in lithium case, if you are giving, it will be exacerbated if you are giving thiazide. So the treatment is amiloride. Euglycemia with DKA occurs in glyphosine, SGLT2 inhibitor. Ramsay-Hunt syndrome affect which cranial nerve, facial nerve, Chromosome in Alzheimer's disease 1421, pseudopapillitis associated with hypermetropia, Amsler's sign is in Fuchs endothelial dystrophy, Leiden paralysis associated with atypical depression, STI is actually external audio disease gland. Hypnagogic hallucination associated with narcolepsy, marbling. You have to remember it is 36 to 48, minimum 36. Juvenile is less than 18 and ossification center before birth occurs in Talus, that is 7. Calcaneum, it is 6 months, Talus 7 months CT, and you can CT scan, you can remember like that. That is calcaneum, talus, then S for sacrum, and femur and tibia, that is lower femur, upper tibia. Ligature around neck, I'll give you a mnemonic, that is 3, 5, 3 into 5 is 15 and then 20. So 3 for jugular vein, and then you have the artery, carotid artery, then trachea, then vertebral artery, vata. 3, 5, 15, 20. Smegma will appear on the corona glands if no sexual intercourse for 1 day. GBS mimics. The vaccine is influenza, virus is Zika, and poisoning is arsenic, because there will be polyneuropathy. So that's all for today, and keep pushing hard, keep hammering towards your goal. Thank you so much.